Hello everybody. Sorry I haven't posted in a bit, but I want to talk about something that's affected me recently, and that is taking medication when you have autism, and in particular remembering to take your medication and how much dosage you need. Even though I work in healthcare, sometimes I can be really good at helping other people, but I can be useless at remembering to take my own medication. And I utilise various tools for this, like I use Alexa to remind me and stuff, but sometimes I forget to ask Alexa. And it's all part of something called executive dysfunction, which goes alongside autism. And so, because I have an anxiety disorder, I have certain medications to help for anxiety, and they're called SSRIs. Selective serotonin reuptake inhibitors, and what they do is they help to increase the level of the happy hormone serotonin in the brain to rebalance how we're feeling. Okay, so the aim is to hopefully reduce our anxiety, and this is the first time I've ever experienced this, and it's been awful. awful. So a couple of days ago, I couldn't remember whether I took some medication in the morning, because I take lots of medication. I couldn't remember whether I'd taken my SSRIs, and so I took some more, and then got something in my eye, and then it came the afternoon, and I genuinely couldn't remember whether I'd taken them again, and so I took some more. So I took a triple dose of SSRIs by accident. Now, it's still pretty much within the normal dosage, because my dosage is not dead high anyway, but because my body isn't used to such a high dosage of SSRIs, of this medication, at first I was fine, went to bed, felt fine, thinking I've just taken the normal dose, and then I woke up and good God, my heart was racing so fast. Honestly, it was like, it was so fast. It must have been over 100 beats a minute. It was really fast. And I felt like everything was speeded up. Like I felt like I'd taken something illicit. It was really bad. And so I thought, well, let me go back to bed and I'll wake up and I'll be fine. And I woke up again about 2 hours later, and my eyes was massive. They was huge. I felt like I couldn't shut my eyes till I had to squint to make my eyes go back to the normal. When I looked at myself in the mirror, my eyes were like that, and it felt like I had matchsticks opening up my eyes. And have you ever seen hypothyroidism, patients with hypothyroidism, that's high metabolism, sometimes they get this, their eyes bulge and they look massive, and that's what mine was doing, and I couldn't relax my eyes. And then I got these tremors, and I was shaking. I still do have that now. I was like proper shaking tremors. It's not funny, but it is funny, because it was like I'd taken something illicit. And then I couldn't walk. I tried to walk down my stairs and I couldn't walk. My legs wouldn't move, so I couldn't put one leg in front of the other. And I phoned my dad and I said, God, Dad, I think I need to go to hospital because I've taken too many of these SSRIs by accident. Anyway, I looked on Google, and it said that, because it's called serotonin syndrome, and I had the mild serotonin syndrome. And he said that once you stop taking that medication, hopefully the symptoms should pass. And that's what I've done, and it's been like 72 hours now, and I'm still here, which is a good sign. And a lot of the symptoms have gone. I still do have the shakes and feel a bit jittery and agitated, but I swear to you, please try and remember when you've taken your medication, because that was freaking awful. I don't ever want to go through that again. Even when I was talking and my voice was going really fast, and it was like I was dead agitated. It was like I'd taken something. And what I should have done is clean my house, because I would have done a really good job of cleaning my house in that situation, because I felt like I was buzzing. But oh God, what a terrible set of symptoms is serotonin syndrome. But it's something that autistic people struggle with, you know. It's an invisible disability. A lot of people that don't have autism, they don't realise that we struggle with these things. We struggle with regulating our medication, remembering when we've taken it, especially if you've got ADHD on top of it. We have like executive dysfunction. And because it's an invisible disability, people don't necessarily see that we are struggling with these things on a day-to-day basis, especially if you're a high-functioning, I hate using that word, autistic person. But yeah, serotonin syndrome, oh my goodness, never ever want to go through that ever again in my life. Remember to take your medication.